Yes, good morning to all. In last class, we discussed the pharmacological actions of adnergic drugs. So in today's class, I'm going to explain about adverse effects and contraindications of adrenaline and other important features of adrenergic drugs. Okay, so first one is, what is the adverse effects of adrenaline? So adrenaline, if it is given by subcutaneous route or intramuscular route, means there is a restlessness. Okay, it is one kind of adverse effect. So the restlessness means what? The person is inability to relax or rest. Okay, as a result of anxiety. Okay, and palpitations is nothing but the feeling of having high heartbeat. Okay, and anxiety, tremors. So tremors means what? That is a rhythmatic shaky movements. So this rhythmatic shaky movements is occurs due to what? uh, Neuromuscular transmission. Okay, what is that? Adnergic drugs act on skeletal muscle is what? So adnergic drugs is facilitate the neuromuscular transmission. So nothing but what it is, the acetylcholine action on skeletal muscle is what? That is increases the contraction. Okay, the acetylcholine, it is act on skeletal muscles. Okay, so it is facilitate the release of what? Acetylcholine from the nerve terminals. Okay, so here this adrenaline, it causes the tremors because of the what? Neuromuscular transmission, the elevated levels of neuromuscular transmission. So why? Because of the adrenergic drugs effect on skeletal muscles is it is facilitate the neuromuscular transmission. Okay, and as a result of that effect, there is a tremors, it will be happens because of the acetylcholine action on skeletal muscle is what? Contraction effect. Okay, and the pallor means what? There is a unhealthy pale appearance. Okay, so that is called as pallor. Or if adrenaline, it is given by IV route or at the high doses, it may cause us the cerebral hemorrhage. So what do you mean by cerebral hemorrhage? The bleeding. Okay, so the bleeding is occurs from the ruptured vessels. Okay, so those vessels which are present in brain, that is called as cerebral hemorrhage. Okay, so it is occurs due to what? High BP. Okay, and arrhythmia means irregular heartbeat. Okay, so this is a side adverse effects of what? Adrenaline. Okay, at the high doses of this drug, it may cause us a cerebral hemorrhage due to high blood pressure. Okay, and irregular heartbeats also. And the next one is contraindications. So what do you mean by contraindications? So contraindications means it is a specific situation. So in this situation, in which a drug or any other surgical procedure, it should not be used because of it may harmful to the person. That is called as contraindication. Okay, it is kind of specific situation. In this situation, any other drug or any other surgical procedure should not be used. Why? Because it may harmful to that particular person. Okay, so here adrenaline, it should not be used in hypertensive patients. Why it is not used in hypertensive patients? Because of what is the adrenaline effect on heart is what? It is activate the beta receptors in heart region, and it causes the what is if it is binds with alpha receptors means it causes the vasoconstriction. Okay, if it is binds with the beta 1 receptors means it causes the force, it increases the contraction, increases of force of contraction at the heart region. Okay, so it promotes the what? It may lead to what? Hypertension. Okay, already the person is suffering with hypertension. Okay, so if this adrenaline, it is used in that hypertensive patients means what will happen? The intensity of the disease, it will be increases. Okay, so that's why that adrenaline, it should not be used in hypertensive patients because of the person is already suffering with hypertension. So adrenaline effect on heart is what? It is increases the force of contraction and increases the heart rate, and if it is binds with alpha receptors means it causes a vasoconstriction effect. Okay, so that's why adrenaline, it should not be used in hypertensive patients. And this adrenaline, it should not be used in hypothyroidism patients. Hyperthyroidism patients. So hyperthyroidism means what? Okay, so the T3 and T4 levels is increases. That is called as hyperthyroidism. Okay, so in hyperthyroidism, what will happen in that patients? These levels, the high levels of this T3 and T4 is, it makes the patients more sensitive to sympathomimetic drugs. Okay, so in that person, in hyperthyroidism person, the T3 and T4 levels is increases. So that T3 and T4 levels are, what will happen in the T3 and T4 levels is increases means the patient is becomes very sensitive to what the sympathomimetic drugs. Okay, so sympathomimetic drugs is nothing but what? Adrenaline. Okay, so that's why the actions of adrenaline it is increases, and some of the cases the toxicity is also occurs. Okay, so that's why adrenaline it should not be used in hyperthyroidism patients, because of the in that particular persons, that person is becoming very sensitive to that person will become very sensitive to what? Adrenaline. Okay, and that drug should not be used in angina pectoris, because of in angina the main sign of that angina is what? The heart rate is increases in angina pectoris disease. Okay, if adrenaline it is used along with angina pectoris means what will happen? The heart rate is increases. Okay, the adrenaline effect on heart rate is what? Heart rate is increases, effect on heart. At the same time, and angina is one of the symptoms is what? The heart rate is increases. So that's why this adrenaline it should not be used in the patients who are suffering with angina pectoris, because of the severity of this angina pectoris it will be increases, because of angina is one of the symptoms is the heart rate it is increases, and adrenaline effect on heart rate is also increases. Okay, that's why the severity of angina pectoris is also increases. Okay, that's why adrenaline should not be used along with angina pectoris. And the second contraindication is the adrenaline it should not be used along with the beta blockers. Okay, the drug it should be contraindicated the patients who are receiving the beta blockers. Okay, why? Because so beta blockers means the drugs are very active against the only beta receptors, because of this beta blockers are selectively block the beta receptors. Okay, not alpha receptor. It is selectively block the which receptors? Beta receptors. Then what will happen? The beta actions only suppressed. Okay, in that cases the alpha actions it will be increases. The persons who are taking these beta blockers, in these cases, what will happen? Only block the actions of beta receptors. In that cases, the alpha actions, it will be increases. Okay, so there is a overstimulation of alpha receptors. As a result of stimulation of alpha receptors, then what will happen? Vasoconstriction it will be happens, because of adrenaline effect on if adrenaline it is binds with alpha receptors means what will happen? Vasoconstriction is happens, because of that vascular smooth muscles consist of what? Alpha receptors. Okay, then what will happen if the persons who are taking this beta blockers means in that persons the alpha stimulation is very high, nothing but the vasoconstriction effect it will be occurs. Okay, so in that cases if adrenaline if it is used along with the beta blockers means what will happen? The in the severity of that condition is increases, nothing but the vasoconstriction effect it will be increases. Okay, because of in that patient beta blocker is blocked, beta receptor function it will be blocked, nothing but the alpha stimulation effect it will be increases, because of this drug is only block the beta receptors but not alpha receptors. Okay, only block the only block the what kind of receptors? Beta receptors. In that cases the alpha receptor activity it will be increases, nothing but it causes the vasoconstriction. So what is the adrenaline effect on alpha receptor is what? Vasoconstriction effect. So nothing but it may potentiate the activity of constrictory effect activity, constrictory activity it will be increases. Okay, so that's why the drug should not be used along with beta blockers. Okay, and the drug it will be contraindicated the persons who are taking the beta blockers. Okay, and adrenaline it should not be used during the anesthesia. Okay, should not be given during the anesthesia by halothane. Okay, why? Because of this halothane, it is sensitize the heart. Okay, it is increases the sensitization of the heart. Nothing but what will happen, that heart is very the sympathomimetic drugs is very sensitive to what? Heart. Okay, so nothing but this halothane, it is potentiates the activity of, it is stimulate the actions of what? Adrenaline. Okay, that if it is adrenaline used along with halothane means the actions of adrenaline it will be increases. Nothing but the various cardiovascular complications it will be occurs. Okay, so that's why the drug should not be given during the anesthesia, especially this anesthesia is given by what? Halothane. Okay, because of halothane it is increases the sensitization of heart. The heart sensitivity is increases means what will happen, the adrenaline it is easily it will be show the effects on the heart. Okay, so the heart actions it will be increase, sorry, adrenaline actions it will be increases because of halothane causes the sensitization of it is stimulate the sensitize the heart. Halothane it is stimulate the sensitize the heart. Then the sympathomimetic drugs, nothing but adrenaline it is easily it can shows the effect on the heart. So the heart inotropic effect, chronotropic effects it will be increases. Nothing but finally the arrhythmia is also occurs. Okay, the irregular heartbeat is it will be occurs. Okay, so this one is adverse effects and contraindications of what? Adrenaline. Adrenaline it should not be used in hypertensive patients, hyperthyroidism patients, angina pectoris patient, and the persons who are taking with the beta blockers. And it is not used during the anesthesia by halothane because of halothane is potentiates the arrhythmic actions of adrenaline. Okay, and next one is dopamine. Okay, so this dopamine it is a metabolic precursor of the norepinephrine. Okay, it is a metabolic precursor of what? Norepinephrine. And because of this, dopamine is converted to norepinephrine in synaptic vesicles region. Okay, and it is converted to epinephrine. Okay, and it is a central neurotransmitter. This neurotransmitter is important in the regulation of the movement, body movement, and the drug having more intrinsic pharmacological properties also. Okay, and this dopamine it is synthesized in epithelial cells of proximal tubule. So what is that epithelial cells of proximal tubule? Proximal tubule means what? It is a renal, it is a one part of nephron. Okay, so in peripheral region it is synthesized in epithelial cells of proximal tubule. So what is the effect? What is the dopamine effect on nephron? Nothing but kidney region. It may cause us the local diuretic effect or natriuretic effect. Okay, means what? Natriuretic effect means what? Excretion of large amount of sodium in the urine, that is called as natriuretic effect. And diuretic means what? It is potentiates the formation of urine, and it is potentiates the it is stimulate the excretion of what? Our body fluids. Okay, so in dopamine activate dopamine, it is also synthesized in epithelial cells of proximal tubule. And what is the effect? Is diuretic effect, means it promote the formation of urine, and natriuretic means it promote the excretion of sodium. Okay, and dopamine it is metabolized with the help of MAO, monoamino oxidase enzyme, and COMD enzyme. Okay, and the drug it will be ineffective when it is given by oral route. Okay, and the drug does not cross the blood-brain barrier. Dopamine does not cross the blood-brain barrier. Only levodopa it crosses the blood-brain barrier. Dopamine does not cross the blood-brain barrier. And the drug should be given by IV route. Okay, because of it is ineffective orally. That's why it should be given by IV route. And the dose of the drug is 0.2 to 1 mg per minute IV infusion. Okay, the drug should be given by IV infusion, not by oral route. Okay, and the dose of the drug is 0.2 to 1 mg. Okay, and it is increases the BP. Dopamine, it is increases the BP, and it increases the urine flow also because of the drug having diuretic effect. Okay, and what is the mechanism of action of this dopamine? Okay, so dopamine, it can activate the alpha receptors and beta receptors. It is alpha agonist and beta agonist. It is not only binds with the dopamine receptors, it is also binds with alpha and beta. It is a weak alpha and beta agonist. Okay, and especially this dopamine, especially D1 receptors. So especially D1 receptors is present in mesenteric blood vessels and renal blood vessels. What is mean by mesenteric blood vessels? Mesentery means what? Mesentery means it is an organ. It's a one kind of organ. That organ, it is attached the intestine. Attach the intestine to posterior abdomen wall in human beings. Okay, so that is called as mesentery. Okay, so and renal blood vessels. So this here the dopamine, one kind of receptor, D1 type of receptors is present in mesenteric blood vessels and renal vascular blood vessels. And this mesenteric organ, it is helps in storing of the what fats. Okay, and this part will allow the blood vessels and lymphatic vessels to supply to the what intestinal region. Okay, so here the D1 receptors is mainly present in mesenteric blood vessels and renal vascular beds, means renal blood vessels. So what is the D1 receptors? Okay, what kind of D1 receptor? D1 receptor, it is associated with which kind of G protein? That is GS. Okay, D1 receptor is associated with GS protein. Okay, so what will happen as a result of activation of that GS protein? Then increases the adenylyl cyclase activity. Then increases the formation of ATP to cyclic AMP. Okay, then what will happen? Wait, I will draw. The D1 receptors are located at which region? D1 receptors, it is present in renal blood vessels and mesenteric vessels. And what kind of D1 receptor? D1 receptor is GS coupled receptors. So GS coupled receptors means what? It is activate the one kind of enzyme that is known as adenyl cyclase. Okay, so adenyl cyclase enzyme activation is increased, means what will happen? There is a formation of cyclic AMP. The cyclic AMP formation is increases, means this adenyl cyclase enzyme is increases the conversion of ATP to cyclic AMP. So the cyclic AMP levels is increases in vascular smooth muscles. Okay, the cyclic AMP formation is increases in vascular smooth muscles. Then what will happen? The cyclic AMP formation is increases in vascular smooth muscles, means there is a what will happen? There is an inhibition of one enzyme that is known as myosin light chain kinase. Okay, then what will happen? There is no phosphorylation of the myosin protein. Nothing but the contraction effect, it will be reduced. So the contraction effect will be reduced, means what? There is a dilation effect, it will be produced. Okay, because of the cyclic AMP in smooth muscles, it causes a vasodilation. Because of it is inhibit the myosin light chain kinase enzyme. So there is no phosphorylation of myosin. So that's why there is no contraction. Nothing but a relaxant effect, it will be produced. Okay, so here the dopamine, after binding with the D1 receptors, then what will happen? There is a vasodilation thing happens. Okay, there's a vasodilation effect, it will be produced at which region? Mesenteric blood vessels and renal blood vessels. Okay, And this dopamine D2 receptors. D2 receptors is also found in the presynaptic adnergic neuron. Okay, presynaptic what adnergic neurons. Then what will happen? It is modulate the release of norepinephrine from the presynaptic nerve terminal. See this. So this one is presynaptic nerve terminal, and this one is postsynaptic nerve terminal. Okay, this is presynaptic and postsynaptic. So this D2 receptors is present in presynaptic nerve terminal. Okay, so D2 receptors are present in presynaptic nerve terminals. Then what will happen? So this dopamine, it is stimulate the D2 receptors. Okay, this receptors is present in presynaptic nerve terminals. Then this D2 receptors is modulate the release of other neurotransmitters. Okay, it is where their activation of interface with norepinephrine release. It is modulate the release of other neurotransmitter that is known as norepinephrine. Okay, this one is mechanism of action of what dopamine. Okay, and next thing is what is the uses of this dopamine indications. Okay, so when dopamine it is given through IV route, means it is used to treat the cardiogenic shock and septic shock. Cardiogenic shock means what? Cardiogenic shock means the heart is, it cannot pump the enough blood, okay, to meet the metabolic demands of the body. That is called as cardiogenic shock. What do you mean by septic shock? Septic shock means what? Septic means the infection is occurs, the infection is present throughout the body. That is called as septic shock. So in that cases, the BP, it will be reduced very drastically. Okay, it will be reduced very rapidly. In septic shock, the BP, it will be reduced very rapidly. Okay, so here the IV infusion of this dopamine is used to treat the cardiogenic shock and septic shock, because of it is increases the blood pressure, okay, in septic shock. Okay, and it is promote the activity of heart also, dopamine. Okay, it is used to treat the cardiogenic shock. Cardiogenic shock means what? The heart is unable to pump the enough blood to meet the metabolic demands of the body. That is called as cardiogenic shock. So here, and next one is this drug is used to treat the congestive heart failure. And the dose of this dopamine is regulated by monitoring the BP. Okay, because of dopamine, it is increases the BP. Dopamine effect on, because of this dopamine, not only binds with the dopamine receptors. Okay, it is a agonist, alpha agonist, and it is beta agonist. It is binds with alpha receptors and beta receptors. Okay, so the effect of dopamine on BP is it is increases the BP. So the dose of the this dopamine, it will be calculated by monitoring the what? BP. Okay, and urine formation, because of what is the dopamine effect on nephron is kidney, means what? It shows a diuretic effect, weak diuretic effect and natriuretic effect. Okay, so that's why the dose of the drug, it will be calculated is based on regulated by, means is calculated by with the help of monitoring the BP and collection of the urine also. Okay, and at higher concentration of this drug, it is activates the what? Alpha 1 receptors. Okay, at higher concentration of the dopamine, it is activate the alpha 1, not A1. It is activate the alpha 1 receptors. Okay, so as a result of activation of this alpha 1 receptors, what will happen? That may leads to what? Vasoconstriction. Okay, what is the effect of alpha 1 receptor and vascular smooth muscles? That is a constrictor effect. So at higher concentration of this dopamine is activate the alpha 1 receptors. Then what will happen? The vasoconstriction effect will be increases. Okay, and adverse effects of this drug is nausea, vomiting, tachycardia, anginal pain, irregular heartbeat, arrhythmia, headache, hypertension, and peripheral vasoconstriction. Okay, so here the dopamine effect on mesenteric blood vessels and renal blood vessels is vasodilation effect, but remaining peripheral blood vessels, it will be constricted due to activation of alpha 1 receptors. Due to activation of alpha 1 receptors, there is a peripheral vasoconstriction effect will be occurs. Okay, and this one is adverse effects of this dopamine. And the next important features of dobutamine. Okay, so this dobutamine, what is the mechanism of action of this dobutamine? So dobutamine, it is a derivative of dopamine. Okay, it is directly activate the beta 1 receptors. Okay, dobutamine, it is a derivative of dopamine. Okay, but it does not bind with what dopamine receptors, D1 and D2 receptors. Okay, but it is a beta 1 receptor agonist, dobutamine. Okay, and it beta 1 receptors is present on mainly heart region. Okay, and it is potentiates the activity of adrenaline also. Okay, and indication, dobutamine, it is used to increases the cardiac output in acute congestive failure. Okay, as well as inotropic support after cardiac surgery. Okay, this drug is used to increase the cardiac output, especially in congestive heart failure. In congestive heart failure, there is a cardiac output is very less. So here, our dobutamine drug is increases the cardiac output and increases the. It is used as a inotropic support for after cardiac surgery, and it is increases the cardiac output, and it does not significantly changes in peripheral resistance and BP. So here dobutamine drug is increases the cardiac output is a major advantage. Why? Because of this drug is does not significantly changes in peripheral resistance. So there is no changes in peripheral resistance, and there is no changes in the BP. So it is a major advantage, dobutamine having this major advantage over the other sympathomimetic drugs, because of it is increases the cardiac output, but it does not increases the blood pressure. Okay, not significantly increases the blood pressure, and it does not significantly changes in peripheral resistance. Increase the peripheral resistance and increase the BP, but not significantly. Okay, it is increases the cardiac output. That's why it is used for the treatment of congestive heart failure. Okay, and used for the treatment of pump failure, congestive heart failure, myocardial infarction. It is used after the cardiac surgery and congestive heart failure. Okay, and because of this drug is increase the cardiac output, that is a major region, and without significantly changes in peripheral resistance and BP. Okay, and the next drug is ephedrine. Ephedrine, it is a mixed action adnergic drug. Okay, it is a sympathomimetic alkaloid. Okay, and this drug is derived from the Ephedra vulgaris. Note down, the name of the plant is Ephedra vulgaris, and this one is 100 times more potent than adrenaline. Ephedrine, it is 100 times more potent than adrenaline, and the central activities, it is lower than amphetamine. Ephedrine also having central action, but the central action the central actions of ephedrine, it is lower than amphetamine. Okay, and the drug should be taken by oral route. It is very effective by oral route, and the drug long acting than what adrenaline, and the drug, it may crosses the blood-brain barrier. Okay, and it causes a stimulation of CNS, and it is used in the mild chronic bronchial asthma. Okay, so why it is used in chronic bronchial asthma? Because of ephedrine having bronchodilator effect. Okay, because of ephedrine is binds with the beta 2 receptors. Beta 2 receptors is present in bronchial means respiratory region. It may causes a vasodilation effect. Dilation effect it will be produced, and it is used in hypo tension during the spinal anesthesia. Okay, it is used in what hypotension during the spinal anesthesia. And amphetamine, next one. So amphetamine, it is a synthetic compound. This compound is similar to what ephedrine. okay, but have more CNS action. This amphetamine having more CNS action than epinephrine. Okay, why CNS actions it will be produced? Because the central actions of amphetamine, it is mediated by the release of norepinephrine from adnergic neurons, especially in the brain region. Okay, so here this amphetamine, it is mediated by the release of what? Noradrenaline from adnergic neurons. Okay, so here first amphetamine drug, this one is synthetic compound. So this amphetamine, it is enter into the presynaptic nerve terminals. Okay, and it is binds with NET. NET means norepinephrine transporter. DAT means dopamine transporter. So with the help of this transporter, this amphetamine, it is enter into the presynaptic nerve terminals. Okay, then this presynaptic nerve terminal consists of synaptic vesicles. So the synaptic vesicle consists of VMAT, means vesicular monoamine transporter. So this transporter is present on the membrane of synaptic vesicles. So this transporter will allow the amphetamine into the synaptic vesicles. So here this amphetamine, it is stimulate the release of norepinephrine into the cytoplasm of the preganglionic neuron through the what? This VMAT transporter, means vesicular monoamine transporter. Okay, so this purple color thing is what? Norepinephrine. Okay, and this red color thing is what? Amphetamine. So amphetamine, after enter into the synaptic vesicles, so this amphetamine is stimulate the release of norepinephrine into the cytoplasm. Okay, neuronal cytoplasm. Okay, then this norepinephrine, it is binds with again norepinephrine transporter, and this norepinephrine transporter will allow the norepinephrine into the synapse region. Okay, then this norepinephrine is binds with alpha and beta receptors on effector cells, and here one more transporter is there, this NET transporter. So this NET transporter will allow the exchange of amphetamine and norepinephrine. Okay, here the amphetamine is entered into the cytoplasm, neuronal cytoplasm. Then norepinephrine, it is entered into the synapse region. Okay, by exchange diffusion process. By exchange diffusion process, this NET is allow the exchange of amphetamine and norepinephrine. So norepinephrine is released into the synapse region, and when amphetamine is entered into the neuronal cytoplasm, means when norepinephrine is entered into the synapse region. Okay, so here the central actions of amphetamine. Amphetamine, it is freely penetrate to blood-brain barrier, and it is a CNS stimulant drug, and it is more, amphetamine having more CNS actions than ephedrine. Okay, why? Because means the CNS actions of amphetamine, it is mediated by the release of norepinephrine. Okay, so this norepinephrine is releases from the adnergic neuron, especially in the brain region. Okay, so this one is the mechanism of release of noradrenaline from the preganglionic neurons or presynaptic nerve terminals. Okay, so that stimulation is occurs by amphetamine through which transporter? NET transporter and VMAT transporter. So with the help of this transporter, this amphetamine is stimulate the release of norepinephrine from the presynaptic nerve terminals. Okay, so that central actions of amphetamine, it is mediated by the release of norepinephrine, and it is improves the alertness and increases the attention, and it is increases the concentration of particular things, and increases the performance, and it is nothing but it is a CNS stimulant drug, and the work capacity is also increases, and increases the talkativeness power also. Okay, amphetamine, and that's why this amphetamine, it is improves the athlete performance temporarily, followed by deterioration. And the drug is used in the treatment of attention deficient hyperactive disorder, ADHD. Attention deficient hyperactive disorder means what? It is a one kind of neurodevelopmental disorder. Okay, so this neurodevelopmental disorder, it is characterized by inattention or excessive activity. Okay, so in this, the person is difficulty in paying attention to particular things. Okay, and the reduction in the reduction in inability to concentrate. Okay, means the concentration power, it will be also reduced. The person is inability to concentrate on particular things. Okay, so these are the symptoms of ADHD. Okay, so amphetamine, it is used in the treatment of attention deficit hyperactive disorder. Means it is a one kind of neurodevelopmental disorder. Okay, mainly it is characterized by inattention and excessive activity. Inattention is nothing but difficulty in paying attention, okay, on particular whatever the things. Okay, and phenylephrine, it is a alpha 1 agonist. Okay, so this alpha 1 agonist, it is nothing but it is stimulate the which receptors, alpha 1 receptors, and this phenylephrine, it is act as a nasal decongestant. Okay, it is a oral or nasal decongestant. What do you mean by decongestant? Means the drug, okay, phenylephrine, it is a drug. The drug, it is used to relieve the nasal congestion. Nasal congestion means what? Means the blockage of nasal ways. Okay, so the blockage is occurs due to accumulation of the mucus and some other fluids. Okay, it is occurs due to some other irritants or cold environment. The blockage is occurs due to any irritants, okay, and cold environment or any other kind of infections. Okay, and the drug, this phenylephrine drug, is mainly act as oral or nasal decongestant. Okay, the drug is used to relieve the nasal congestion in especially in the upper respiratory tract. Okay, and the drug is used as a mydriatic effect, means dilation of pupil. Okay, and it is decreases the intraocular tension by constricting the ciliary blood vessels. By constricting the ciliary blood vessels, there is a decreases the what? Intraocular tension. Okay, and the drug having long duration of action, that is 4 to 6 hours. Okay, and this one is some important features of adnergic drugs, and here some nasal decongestant drugs is there. So topical nasal decongestant drugs, so that is oxymetazoline and xylometazoline and nafazoline. Okay, so this drug is alpha 2 agonist. So then what will happen? Alpha 2 agonist means here I will alpha 2 agonist. So alpha 2, it is what kind of receptor? Alpha 2 receptors are GI coupled receptors. So then what will happen? GI coupled receptors means there is an inhibition of adenyl cyclase enzyme. So then there is a decrease in the formation of what? Cyclic AMP. So decrease in the formation of cyclic AMP means what? The cyclic AMP formation is decreases means what will happen in smooth muscles. Okay, there is a contraction effect will be occurs. Okay, because of there is no inhibition of adenyl cyclase enzyme. So there is no inhibition of adenyl cyclase enzyme means what will happen? There is no inhibition of adenyl cyclase enzyme means there is no there is a phosphorylation of myosin. There is a phosphorylation of myosin protein. So nothing but there's a contraction effect, it will be produced. Okay, so that's why it is used to relieve the nasal congestion. Okay, so then what will happen? There is a contraction effect. The contraction effect is occurs means what? Vasoconstriction effect, it will be produced because of this oxymetazoline, xylometazoline, nafazoline after binds with alpha 2 receptors. Then what will happen? The cyclic AMP formation is decreases, means there is a contraction effect, it will be produced in the smooth muscles. Okay, so as a result of contraction, there is a clearance of mucus. Okay, as a result of constriction effect, it stimulates the clearance of that mucus from that nasal ways. Okay, so nasal congestion means the blockage which is present in nasal ways. Okay, so that blockage it will be cleared by the constriction effect. Okay, and the drug should be used occasionally in hypertensive patient because of this drug may causes a constriction effect. Okay, so that's why the drug should be used occasionally in hypertensive patients, and the drug should be taken by oral route. That is, nasal decongestants is taken by topical route or oral route. So these oral route drugs are phenylephrine, pseudoephedrine, and phenylpropylamines. Okay, so these drugs are produces a vasoconstriction effect in both the mucosa and skin, and the drug can be used as orally as a decongestant of upper respiratory tract infections. Sorry, it is used as a decongestant in upper respiratory tract and nose and euthanasia tubes. So what do you mean by euthanasia tube? Means it is a small passageway. So that way is connects our throat and middle ear. Okay, it is the tube is connects in between the throat and middle ear. That is called as euthanasia tube, and the drug should be avoided in hypertensive patient. Okay, and because of the constricted effect. So next one, indications, the overall uses of these adnergy drugs. So first one is vascular uses. Okay, so that is hypotensive states. The drug is used for the treatment of hypotension. Okay, so hypotension is occurs due to any other shock. Okay, that nothing but septic shock. Okay, and in septic shock the pp it will be reduced drastically. So that's why this overall that adnergy drugs are used for the treatment of hypertension. And spinal anesthesia, in spinal anesthesia also the hypotension it will be occurs. And the persons who are taking hypotensive drugs. Okay, so hypotensive drugs is also causes the hypotension. So hypotensive states is mainly occurs due to shock and spinal anesthesia and hypotensive drugs. So here our adnergy drugs are used for the treatment of hypotension, and the drug can be used along with the local anesthetics. So why it is used along with the local anesthetics? Because of that halothane and chloroform is sensitizing our heart. Okay, and it potentiates the sympathomimetic drugs, potentiates the activity of sympathomimetics. And this disease used to control the local bleeding. And why it is control the local bleeding? Because of the constrictory effect. Okay, that's why it is used to control the bleeding. And nasal decongestants because of constriction effect, vasoconstrictory effect. Okay, because of this adrenaline, if it is binds with alpha-1 receptors, means what will happen? Vasoconstriction effect it will be produced. Okay, and cardiac use. Okay, what is that cardiac use? It is used for the treatment of cardiac arrest. Okay, and it is used to treatment of atrioventricular block. Okay, especially isoprenaline. Okay, isoprenaline as a temporary measure, and the drug used for the treatment of congestive heart failure. Okay, and bronchial asthma also. Why it is used as a bronchial asthma? Because of these drugs is adnergy drugs effect on beta 2 receptor is dilation effect. Okay, so especially respiratory tract consists of beta 2 receptors. So what is that effect? Is bronchodilatory effect. Okay, so what is the pharmacological actions of adrenaline on bronchial region? Is bronchodilator. Okay, and it is used for the treatment of allergic disorders. So here adrenaline, it is a physiological antagonist. Okay, physiological antagonist of what? Histamine induced ulcers. Okay, so that's why it is used for the treatment of allergy. And midriatic effect. Okay, and it is used in the treatment of open angle glaucoma. Okay, and insulin hypoglycemia. In what is meant by insulin hypoglycemia? Insulin, it may cause us insulin. If insulin activity is very more in that in our body, means there is a BP, means sorry, not BP, blood sugar levels, it will be decreases. That is called as hypoglycemia. Here our adnergic drugs effect on metabolic. What is the metabolic effects of adnergic drugs? That is increases the what blood sugar levels. Okay, plasma glucose levels, it will be increases. Okay, because of this our drugs, it here that adnergic drugs is decrease in the release of insulin. Okay, decrease in the release of insulin is nothing but what will happen, there is no conversion of glucose to glycogen, nothing but the peripheral glucose levels, it will be increases. Okay, and seventh point, that is nocturnal enuresis in children. Means what? That is involuntary urination is occurs at the night time. Okay, especially it is occurs in children's. Okay, and it is urinary incontinence. So amphetamine, it is a CNS stimulant drug. Okay, it is increases the alertness, mental alertness. It will be amphetamine, it is increase the mental alertness, and it is very CNS stimulant drug. So this drug, it is used for the treatment of nocturnal enuresis, especially in children, and urinary incontinence in adults also. And next one is, it is act as a uterine relaxant. So example is ritoridine. This drug is used to postponement of what? Labor. Because of if this adrenaline drug, it is binds with alpha receptors, means it causes the constriction effect. If it is binds with the beta receptors, means what will happen? Dilation effect, it will be produced. What is the pharmacological action of this adrenaline on what? Smooth muscle is dilation effect. Okay, so this ritoridine drug, it is used to postponement of labor because of dilation effect. Okay, and isoxaprine, it is also used to treatment of it is used in threatened abortions. Okay, means this kind of abortion is occurs below the or less than 20 weeks of gestation period. Okay, so if abortion is occurs below the or less than the 20 weeks of the gestation, that is called as threatened abortions. So isoxaprine, it is your drug is causes the dilator affection, not affection. Isoxaprine, it is causes, it is main effect of isoxaprine, it is relaxant effect. Okay, so this isoxaprine drug having relaxant effect on that smooth muscle, that is called as uterine smooth muscles. So that's why it is used in threatened abortions. Threatened abortions is means what? It's one kind of abortion with vaginal bleeding. It is occurs less than 20 weeks of the gestation period. Okay, it is occurs at the time of 20 weeks or below 20 weeks. And dysmenorrhea means painful menstruation. Okay, so this painful menstruation is relieved by isoxaprine. Okay, because of isoxaprine having relaxant effect. And what is the central uses? It is used for the treatment of ADHD disorder, that is attention deficit hyperkinetic disorders. Because of here, amphetamine is the CNS stimulant drug. Okay, that's why it is used for the treatment of attention deficit hyperkinetic disorder. And narcolepsy, nothing but is a sleep disorder. Okay, it is characterized by excessive sleep. Okay, here amphetamine is the CNS stimulant drug. So that's why the amphetamine is used to relieve the narcolepsy. And modafinil and imipramine like drugs. So these drugs are used to treat the narcolepsy. And epilepsy. And epilepsy also, amphetamine is used to use for the treatment of what? Epilepsy and Parkinsonism. Okay, so these are the uses of what? Adrenergic drugs. Okay, so in next class we will discuss about alpha blockers, nothing but anti-adrenergic drugs.